Good day. My name is Cary Cooper. I'm a professor at the University of Manchester in England. I do work in the field of health and well-being, and my presentation today is going to be called Mental Capital and Well-being at Work. And what do we do about it? Why are we moving in the direction of looking at stress and mental well-being in the workplace? What are the costs of it? What are the sources of problems? And what can we do about it? So let's start, and let's start at the beginning. Let me just give you an illustration of this. The UK government publish annually long-term absence in the UK, and it was in this year, just a couple of years ago, where we found that stress and mental ill health were the leading causes of sickness absence in the UK economy across the board. It used to be musculoskeletal diseases, but in the year, about 3 or 4 years ago, it shifted from backache to mental well-being. And you can see the two categories here are stress and mental ill health. If you combine them, they are really very problematic and causing quite a lot of ill health in the workplace and also being very expensive to business. Now, these are last year's figures, and it's very complicated drawing, but this comes from the Health and Safety Executive, which is the equivalent of NIOSH in the United States. And you can see that 57% of all long-term sickness absence was due to stress, depression, and anxiety, and only 25% due to musculoskeletal diseases. So that just figures I think you might like to look at when you're looking at it. This data is pretty well collected. It is pretty robust data from the equivalent of NIOSH in the UK. And you can see that nearly 600,000 cases in 1 year alone in 2017-18 were suffering from anxiety and depression, an increased number of cases. It is a real problem area. But it's not just in that area. Here's another thing. Prior to the recession of 2008, a group of economists, top economists working for the Sainsbury Center of Mental Health, found, incidentally, although I'm using UK and European data, there's a lot of US data which supports this in any case. You know, this is a global phenomenon in the developed world, not in the developing world, but in the developed world. But a group of economists prior to the recession of 2008 collected data on the whole issue of absenteeism and presenteeism. Now, presenteeism is, strangely enough, a term that I coined in the 1980s in talking to a journalist when we had a mini recession globally. And then the journalist said to me, Cary, he said, I can't understand it. The figures are showing in the middle of this recession that sickness absence is going down. How could it go down when the stress levels of job insecurity and the like on people? And I said, well, would you want to, if you were feeling ill or low or depressed, would you stay at home at a time when your job is insecure? You would not. You would show FaceTime. You would be present. So although absenteeism is going down, presenteeism is going up. So the scientists in 2007 was the first time they collected data on this and found that presenteeism in the UK, for example, was double the cost of absenteeism. So a real big issue. And since then, I've done a book for Cambridge University Press looking at all the science on this. And presenteeism a real worry, because since that recession, there has been intrinsic job insecurity throughout the developed world. First the recession, then we've had COVID, and now we're going into a really bad recession. 4 or 5 times worse than the recession that we experienced in 2008. So presenteeism is a big issue. Now, what is presenteeism? Most people talk about it as sickness presenteeism. I'm unhealthy, but I turn up to work because I'm frightened of not, because I don't want it on my HR record. Then this model just says, look at what we want in all our economies is a population of people who are healthy and present. That is what we want, the top left-hand side. But we will get sickness presentees, people who turn up to work even when they're ill. We'll also have healthy people, not always present at the job, dissatisfied people. They're healthy, but they hate their job. And they turn up to work, but they don't deliver much added value. And then I have the unhealthy and not always present. So I did a big study, a national study, that went across, well, most of, I would say, the UK primarily, but most of Western Europe, not Eastern Europe. And we looked at 39,000 people, and lo and behold, we found out that 28% were sickness presenteeism on a regular basis. But which is real worrying to me is only 35% of people reported themselves to be, and this is a study I did a year ago, 35% of people reported themselves to be healthy and present. That means only a third of our working population is actually getting on with the job, performing, and showing added value. 13% were job dissatisfied. They're healthy. They turn up to work, but deliver very little added value. This is a real problem we have. So the issue from a measurement point of view is this: is now sickness absence a good indicator that an organization has problems? And the answer is no. You have to measure presenteeism as well. If your sickness absence rates are high, you really do have a problem, because people are feeling really very insecure. And now, us going into a massive recession, I would call it a depression, given the GDP in many countries is going to be down anywhere from 20 to 30%. What you're going to have to look out for is presenteeism as a better indicator of what people are actually feeling. Now, I've collected a lot of data. The OECD did a study of all OECD countries to look at mental ill health in the workplace and what it was costing the GDP of countries. So in the UK, for example, it was 4.5% of GDP. That's massive. So mental health is a real problem area, a lack of mental well-being in the workplace. And there's lots of data on it. This is more or less just UK data. But it is the kind of data that's reflective of what's going on in Western Europe, particularly in the big economies of France, Germany, Italy, Britain. The really big economies are really suffering from this as an area. So that's why the field of mental capital and mental well-being at work has become big time. Big time in the sense it's become more strategic. Boards of companies are now developing a strategy on it. How are we going to deal with this issue? And they didn't mean EAPs or stress counseling or mindfulness at lunch. It is not about that. It is not about beanbags and ping pong tables. It is about changing the culture of an organization, getting line managers who have high EQ, emotional intelligence. It's about taking a strategic view and doing something quite profound. And many companies in Europe, in Western Europe, particularly in the bigger economies, are actually doing that. Less so in North America, which is strange, but should happen. And I think it's because of the welfare systems and the social support systems most of the European economies have, and the US does not have to that extent. At least the US anyway. Canada is a bit better. So what are the issues that cause people lack of well-being, cause them stress at work? There are all the factors on the left-hand side. Factors intrinsic to the kind of job you do, the role you play at work, your relationships at work, your career development or otherwise, the culture you come from. Is it a bullying culture? Is it a command and control culture? Is it a participative culture? What kind of a culture is it? And then the homework interface issues, which we know are really prevalent now and causing people quite a lot of problems. So these factors on the left-hand side are affecting the individual symptoms, excuse me, excessive drinking, lack of exercise, poor diet, high blood pressure, all those kinds of things, behavioral things too. And then for people like me, I go into an organization when the indicators, the organizational indicators are bad. like high absenteeism, high presenteeism, high labor turnover, poor quality control, accidents, severe incidents of mental ill health or even physical ill health in the workplace, a whole range of organizational indicators. They usually prompt an organization or a professional group like doctors like British Medical Association or the American Medical Association to take action when they see it among their own population. And the model just says if you don't deal with some of the problems on the left-hand side of this diagram, then you're going to have problems on the right-hand side. They're going to have a range of illnesses where stress and lack of mental well-being will affect a particular physical, not just a mental outcome, but a physical outcome too, like coronary artery disease or a range of not just cardiovascular, but any non-communicable disease, diabetes. So a whole range of factors can go into that box on the top. And then there's another box, which is an organizational box below that. In other words, prolonged strikes, frequent and severe accidents, work, apathy, those kinds of things are organizational diseases in a sense, where people are just lack of morale, where people are just not performing well. And something really has to be done. Of course, if you look at this model, if you don't deal with the problems on the left, you even get another box on the extreme right, which is a box that's 6 foot long and goes 6 foot under. That's disease, the ultimate of disease, but whether it's an individual disease, i.e. turning into making you a mortality risk rather than just a morbidity risk, or it can be a company going out of business. And we've seen that. There have been organizations, because of the stress levels on people, where the organization is actually collapsed. And so the model just says we have to deal with the issues on the left-hand side. These are issues that the science tells us cause people to get ill, particularly mental ill health, but not just mental ill health. They are also risk factors to heart disease and a range of other illnesses. So let's go over some of these on the left. Factors intrinsic to the job: too much work, too little work. Every job is different. If you work I've done research on about 85 different groups, from bomb disposal officers in Northern Ireland to a big national study of airline pilots, to teachers, to you name it, I've done it. I've done 85 different occupational groups. I have data, tens of thousands of people. And every job is different. So if you're a professor in a university, it has its own stress fingerprint. If you're a medic, it has its own stress fingerprint. If you're a nurse, its own. If you're a pilot, air traffic controller, and so on. And these are really quite important. And by the way, now, when people are feeling job insecure, it's not just overload, i.e. too much work, that's causing people problems, but it's underload as well. Because what people are worried about is I don't have very much to do, and my boss may know I don't have very much to do. Therefore, I'm quite vulnerable. There's a wonderful book by Joseph Heller called Something's Happened. Now, Joseph Heller's guy wrote Catch-22. You've got to read this book because it's a really interesting fiction book. And Heller worked in an insurance company, wrote the book on the basis of his experiences. But listen to this. These are the kinds of things this is a clever one. So this is about too little work. So one of his characters of the book says the following: I am bored with my work very often now. Everything routine that comes in, I pass along to somebody else. This makes my boredom worse. It's a real problem to decide whether it's more boring to do something boring than to pass along everything boring to somebody else and have nothing to do at all. So it's not just overload, but underload can be a problem. Time pressures, physical work environments, all of these. But every job has a different stress fingerprint. Let me give you an example of that. I did a big study at Manchester Airport many, many, many years ago. I was looking at air traffic controllers and trying to predict. I used fibrinogen and a range of physical measures, which measures people's kind of stress levels or increased risk of coronary artery disease. I looked at what were the factors among air traffic controllers that predicted it. And these were the kind of factors that predicted it. High and variable workload, poor procedures by pilots, like pilots calling in, and the international language of air traffic control is English. And there were pilots talking in their national language, like Portuguese, flying into the thing because they were so stressed out. Responsibility for lives, shift works patterns. These were the factors that predicted increased risk for air traffic controllers. Now, you can deal with some of these. They are responsible for lives, so there's nothing you can do about that. But you can look at high and variable workload. You can look at the shift systems, and training others while you're working was also problematic too. You can do something about these kind of factors, but we need to know the factors in a job that predict an outcome measure, whether it's risk to coronary artery disease or mental health, because unless we know what those factors are, they're going to continue. And all the meditation in the world and mindfulness at lunch is not going to solve the problem. But that gives you an illustration of the factors intrinsic to a particular job. Then role in the organization. How much control and autonomy do you have over your job? This is very important. Tons of research on this. First studies done, and the more people have autonomy and control, the less ill they'll get. We know this from tons of research. We know, for example, so the role you play at work is critical. So I did a big study among California dentists and among British dentists for the BDA, the British Dental Association. These are the kind of factors we found predicted ill health among dentists. And they were factors to do with, they were really people factors, not the technical factors, not looking into people's mouth or standing up all day long. It was factors like managing difficult patients, managing my practice, the administrative duties, the job interfering with my family life, and patients, oddly enough, perceiving me as an inflictor of pain. But what else is new? That is normal, you know. So these are all to do with relationship problems. So the implication there is dentists, when they're being trained, have to be trained to, when they're being trained, not only technically, but how they manage relationships, whether it's their staff or patients, because that is the factors that seem to predict ill health the most. Relationships at work are fundamental. Relationship with your boss particularly. So the science tends to show, these are all potential factors, but the science shows that relationship with boss is probably the most important. And so we have to look at this. Now, it's quite interesting. If you look at Heller, talks at the beginning of his book of Something's Happened. I found this really interesting. He worked in an insurance company before we wrote Catch-22. Look what he says in his opening paragraph. And he talks about this a lot in the book, about relationships being the cause of most stress in the workplace in his fictional account. But he says, in the office in which I work, there are 5 people of who I am afraid. Each of these 5 people is afraid of 4 people, excluding overlaps, for a total of 20. And each of these 20 people is afraid of 6 people, making a total of 120 people who are feared by at least one person. I love this. It's humorous, but it's true. In my department, there's 6 people afraid of me, and one small secretary is not afraid of all, is not afraid of any of us. I have one other person working for me who's not afraid of anyone, not even me, and I fire him quickly, but I'm afraid of him. And it goes on, and it's humorous, but it's telling how significant relationships are in the workplace, particularly with boss, and the science is pretty profound on this. And almost all the science we're doing now in the field of well-being shows that line managers from shop floor to top floor, public sector, private sector, third sector, require managers who have good EQ to be socially sensitive to their subordinates, to recognize when they have unmanageable workloads, unrealistic deadlines, and the like, if you're to create a well-being culture. But these are quite important relationships at the workplace. Another factor, career development. Have you been over promoted, under promoted? Now, job insecurity has been prevalent since 2008 in most developed countries. Well, not just developed. We had a massive recession, 2008 to about 2012. Then we had problems getting back up. Growth rates have been very poor since then, nowhere near pre-2008. And now we're going into a worse recession than you can even imagine. And so, again, job security is a big issue for many. Probably less so in the US because job insecurity is intrinsic to the American business world. You don't have things like we have in the UK, for example. If you've been working for an employer for 20 years, you get 20 months automatically, what we call redundancy pay, if they fire you. You don't get just 2 weeks or a month. That kind of welfare attitude permeates most of Western Europe. It's not intrinsic to the US. So job insecurity is probably people can cope with it a bit more than they can cope with it in Western Europe. Anyway, so career development issues are really quite big issues. I'll just show you an example. A group of economists in the UK were looking at in the middle of the recession and found that, and they were doing a big population study. CMI is the Chartered Management Institute. It's the professional body for managers. And if you take a look at this, you will see that during the beginning of the recession, you can see, say, September 2008, near the beginning, there wasn't a problem. Look at the job insecurity figures as it moves up to 2 years later. And by the 2012, it was pretty high still. Then it started to decline again. So we're going to have this. This is intrinsic. We're going to see this over the next year, big time. And this came out of, I like this. This came out of the Buffalo News during the recession. I thought this was lovely. The bad news, Johnson, is you're being let go. The good news, you're going to have your old job back at half your former pay. I can't live on that. The rest of the good news, we can offer you a second job, also at half your former pay. And I love the bottom bit. I'd offer you a third job, but I'm afraid of overheating the economy. So you can see this is what job insecurity can do. Measurable, we can measure it. We can see what its impact is directly on health. It's quite easy to do this. So another factor is the organization structure and climate. This is really important, and it's measurable again. I do this all the time. I have an instrument where I can measure all these kinds of factors, highly reliable, published in the literature, and used by organizations to do well-being audits. And this is about what's the culture of your organization. Is there effective communication? Is there a lot of uncertainty? Is it non-participative, or is it collegiate? So this is measurable. It's another factor that comes into the mix when you're looking at a well-being culture. And then this one is another one too, and this is becoming increasingly important. It's the work-life balance issue about the family interaction with you, the workplace, the family, your life in general. And these are becoming very big factors. And if you look at almost many employee surveys throughout the Western developed world, you're finding work-life balance comes in the top 3 or 4 issues. And I think that's coming in because of the issues with the changing roles of men and women. More women are pushing the glass ceiling up. They haven't shattered the glass ceiling yet, but they're pushing it up. This kind of issue is creating issues for organizations where there's a demand now for more flexible working. And you can see during this pandemic that actually flexible working, we've been working in the UK, I've been working for 10 weeks now remotely, 100% from home. Everybody has. So the issue is interesting because now people are going back to work, and guess what's happening? They don't want to go back to a central office environment anymore. And most organizations are going to downsize their office space, and we're going to have much more work-life integration occurring. But this is a big issue and has been for quite a while. But it's now, funny enough, the pandemic has brought it to the fore. It's demonstrated we can work a lot from home. People don't want to work exclusively from home. They want more flexibility in where and how they work. And this pandemic is enabling that to happen. So those are the kinds of things that are really, I think, important, and we have to understand them. So those are the factors that cause ill health in the workplace, particularly mental ill health, but also physical ill health as well. And we need to be able to identify them. Organizations need a strategy to deal with it. This is the strategy. I developed this strategy working with the European Union, the EU, 28 nations, and we came up with, me and a colleague came up with what we need to do to manage the stress we're finding in the workplace and the mental ill health, and it's a primary, secondary, and tertiary approach to it. So tertiary is EAPs, counseling services to help people who haven't been able to cope. Secondary is providing training, whether it's resilience training or whatever kind of training you need, lifestyle training, and so on, to help people develop skills that they need to manage the workplace better and manage all the multiple demands from both from home and work to deal with it. And then the primary strategy is what we need to do more well-being audits of companies and look at their selection policies, workflow, work-life balance initiatives, management development programs, and so on. But to do that and to find and to actually change the culture of an organization, employees need to fill in and complete well-being audits, and we have a number of them in Europe now, and the Health and Safety Executive in the UK have developed their own. Many European countries have developed their own. I have developed my own, which I use and have published it in the literature, in the Journal of Stress and Health. And what these instruments do, employees fill them out, and you're able to identify if an organization's got problems, where these problems are in the organizations and what they are specifically, and then you can do interventions to sort them out. Because it's like going to an internist, a GP, a general practitioner, and you've got lots of symptoms. And in the case of an organization, it's presenteeism or absenteeism or accidents or some manifestation. And you go to your GP and you say, and you're ready to open your mouth, and the GP says, "Here, take these pills." There's no point. What does your GP do? Your GP takes your blood pressure, takes blood samples. In other words, they do a diagnosis. Organizations, the primary bit of this program is, and what is really important, is to do diagnostic work, finding out how employees perceive the organization, getting all the demographics you can, and identifying for that group over there in that department, there's a problem of long hours culture, and that's causing ill health. In that part, it's a bullying management style, and that's causing people to get ill. In that part of the organization, there's a glass ceiling for women, and it's difficult for women to, and women are getting ill as a consequence of it. And then you can develop policies and programs and interventions to deal with it. But it's, again, data-based and diagnostic-based. And there's lots of good instruments around to do that, and we need to do more of that. I find that in certain European countries, this is happening a lot, particularly the UK, Scandinavia, Holland, countries like that. But again, so primary is I think the most important bit of this, because we've always done secondary by training, and we've always had around EAPs or some kind of counseling service. You want to change the culture so you don't actually have to do much tertiary. Anyway, so that's that one. The evidence is when you do interventions, CIPD is the professional body of HR professionals in several of the European countries, Britain, Ireland, and several other countries as well, outside of Europe as well. And they have found, when they look at the interventions that, and they collect hard data on well-being interventions, it really does improve morale, engagement, lower sickness absence, and so on. PwC, PricewaterhouseCooper, looked at 55 organizations in the UK, and they aggregated it up, and you can see the impact these well-being programs. We don't actually call it like the US does. The US calls it wellness programs. Why we don't do that is because wellness programs tend to mean things like gyms, your physical health. It tends to mean mindfulness. It tends to mean individually orientated programs. Well-being is changing the culture of an organization. That is entirely different, but it's had an impact. The UK, we have found, the UK government set up something called the National Institute of Health and Clinical Excellence to see which drugs are most effective on the National Health Service, but it also then did public health on stress at work and managing mental well-being at work, and it's calculated it's costing the UK economy a lot of money. In 2009, when they first set this up, in that it was 28 billion. It's now, we don't know, but it's double that probably. But the point being that even the government's worried about this as a performance and productivity issue as well as a health issue. And there's lots of cases. I put some case studies in for you. I'm not going to go into in detail into these. This is the Network Rail, which runs the network in the United Kingdom. Again, they have well-being programs, and they have collected really hard data, again, and found it hits the bottom line. A lot of the well-being initiatives are data-driven from the point of view of doing diagnostics, then doing an intervention and collecting the data on the impact of the intervention. This is quite an interesting one. This is one I did with Network Rail. We found that if you enhanced well-being, you could measure it. They had measurable productivity. Productivity is very difficult to measure in many jobs. How do you measure the productivity of a manager, for example? But in productivity of people working on the line, on the rail network, you can measure it. They have measures for that. We found a 0.46 correlation with that. And this was a sample of 2,600, which is roughly a 15%, just under a 15% sample of all network rail workers. We found that to be the case. The most productive had the most psychological well-being. We developed an equation to try to measure what the impact would be in terms of cost saving for the organization, because that's an important part of this. Again, metrics are, does it deliver to the bottom line? If people's health improves, how does that affect the bottom line, whether it's sickness, absence, or whatever? And we found that we saved £1,200 per person, per employee, and that basically we saved for that particular organization by just improving the health and well-being of 15%, £6.1 million in 1 year. If we did it over the whole UK economy, it would save 5.6 billion, which would be the cost of, it's a very substantial cost. So it's a bottom line issue really now. And again, for that particular organization, for a country, if we save 6 billion, that would mean we could recruit 243,000 nurses, or we could buy 21,500 Lamborghinis for that money. But I think we know where we want our money to be spent. Basically, well-being is not this. Well-being is not. Tomorrow is the mandatory meeting on employee health and well-being, says the boss. The meeting starts at 6 a.m. so it will interfere with your sleep, not your work. Doesn't that send a message that work is more important than health, says a colleague? I hope so, says the boss. That's the theme of the meeting. Healthy employees are unproductive. They're always exercising or eating fruit when they should be working. We prefer employees who work hard and die before their pensions start paying out. Suddenly I feel sick, says the employee. Right on schedule, says the boss. So it's humorous, but it's interesting. The point I think I'm trying to make about all this, mental well-being in the workplace is now a strategic board issue in many European countries and in many boards of European companies. It needs to be so in the United States, where it isn't, and it should be. And NIOSH has been brilliant in the past in making workplace stress a big issue, and I was involved with NIOSH in the early days, working up their strategy on stress management. I used to come over to Ohio and in Cincinnati to be with them and work with them on this. So I know them well, great organization, but we need to get the message out to American and North American employers that the future is making mental health in the workplace a strategic bottom line issue. It's highly measurable, and our interventions are measurable. And the only way we're going to convince boards to take this seriously is to do the research that shows what our interventions do, not only for the health and well-being of individuals, but for the bottom line as well. Thank you very much.